Hey y'all. So today I wanted to make a video to talk about the things that I've learned personally when it comes to handling grief as a nurse. Just to give you a little background info on me, I am Tiff. I'm 36 years old and I have been a nurse for almost 10 years. And of those 10 years, literally the entire time I have worked in nursing homes, nursing facilities that focus on long-term care. My cat just knocked the camera down. Anyway, moving on. And for that nearly 10 years of my career, I have been blessed and fortunate enough to have spent the majority of that time with one company. They have been wonderful to me, with the exception of 1 year where I did go and worked at a nursing home that focused on psychiatric patients, and that was a whole nother ballgame. I give big props to you psych nurses out there. Y'all are amazing. The way that you shoulder the things that you deal with on a daily basis, I am forever going to be in awe of you guys. Seriously, psych nurses, psych CNAs, y'all are the real deal. But anyway, over the past decade that I have been a nurse, I have had some of the best and the worst times of my life within the walls of a nursing home. There are moments that shape you forever, and I can list on and on and on the stories that I've been told, the laughs that I've had, the beauty that has been shared with me from the older generations. I'm a millennial, I'm 36 years old, and lifestyles were just completely different. There was a different set of values present with the boomers. It is invaluable to be able to hear first account stories of different events that happened in the world's history. I have had residents share with me stories from World War II, from the Great Depression, and pass along their family stories. And the beauty and the wisdom that is gleaned from that is priceless. And it is such an honor to be able to hear their life stories, their life streams, their life's work, all the things that they were passionate about, all of the people that they've loved, and the stories of their time together. Some of those stories and moments I will hold dear for the rest of my life, and they have shaped the way that I want to live my life moving forward. I'm going to tell you now, if you want to hear a thing or two about really making life count and living a life that matters and that you can be proud of, you're going to hear it from the older generations. It is such a blessing in this day and time to reach old age. It really is. Every gray hair on your head, baby, that's a mark of honor. Every laugh line, every wrinkle, that is a literally a mark of honor and a sign of life hopefully well lived. And you also get an up close and personal account of the regrets, the words left unsaid, the things that they wish that they had done differently, and that changes you. I have always looked at it as being a gift to be able to care for the elderly, but also for people who are experiencing sickness, illness, anything like that in your lives. You really are, as a nurse, dealing with people when they are not at their best, whether it be an illness, whether it be an injury. Maybe they've come to the nursing home for rehab, for physical therapy. But either way, they are experiencing something profound in their lives, and it's not always easy handling that. Decision to even enter a nursing home, even if it's just for physical therapy, it's a short term stay, it is definitely an emotionally big choice. There's going to be high emotion, there's going to be conflict around that decision, whether it be from the patient themselves or from their family members. There's a lot of concern, there's a lot of questions, and rightfully so. I try my best to handle that with as much passion, with as much just comfort and support as I possibly can as a human. Because at the end of the day, that's what I would want done for me, for my mother, for my family, and for the people that I love. As a bedside nurse or a bedside CNA, you really see relationships grow with your residents, especially in long term care settings. In hospitals or clinics, you may see several different patients over the course of several days. They discharge, they leave. And in long term care, it's usually not like that. You may spend months, years even, building up a working relationship with a resident, with the resident's family, and with their entire support staff. And that in itself makes death a lot harder to deal with. It makes grief a lot harder to deal with. I cannot tell you how many times I have clocked out, come home, and literally just bawled, just cried until there was nothing left. I had been a nurse literally about 3 months before I experienced my first death, and I was not prepared. I was not prepared for that as it was happening, from the grief that the family members were going through, and also for the unexpected toll that it put onto me, onto my heart. It's not easy to experience a death, especially in a long term care setting where you have had that relationship built up, where you have had those family members come in and you've hugged them, you've talked to them, and to see them experience that grief. And as a new nurse back then, I definitely was not prepared for what I was about to go through myself. You know, in nursing school, they really push this sense of professionalism and that, you have to set your emotions aside. And that is true. But I'll tell you now, that works better in theory than in practice. It can be one of the hardest things you've ever had to do, to witness a death, to handle that, take care of that, and then to wipe the tears from your face, put on a smile, and walk into the next room. And also, when it comes to dealing with the family members of a resident that's passed, the nursing profession wants you to be as professional as possible to handle your emotions so that you can handle theirs. And that is hard to do as a human. That can be such a daunting thing. But I will tell you, in my experience, there have been times where tears have fallen and the family members will reach out to me and be like, "Thank you. We know that this is hard for you too. You really had a bond with my mother, with my father." And allowing me to see that little bit of vulnerability reminds us that you're human as well. I hear all the time, "I don't know how you do this. I don't know how y'all do this." And speaking from experience, I definitely don't think that it gets easier. I know that some people have a way of kind of desensitizing as time goes on, as they've experienced more of this. But I'm not one of those people. I personally don't think that it ever does get easier. But you do learn through time, through experience, to handle it better. So, what is my advice for nurses that are dealing with grief, or people that are dealing with grief in general? Maybe you're not in the nursing profession, but maybe you've lost someone that you love dearly. Well, this may seem cliche, but grief really is like an ocean. I know we've all heard that expression in the past. It's like a tide that comes in and out, it ebbs and it flows. And sometimes grief can hit you in the most unexpected places and times. You'll be fine. It'll be a day where you feel like, this is fine. I'm seeing progress. I'm dealing better. And then just out of nowhere, just it hits you like that. It's always helpful to remember that that is part of the healing process. You may be broken right now, but you will heal. You will heal. You will heal and you will learn to handle it better as time goes on. If you have a support network of your own, whether it be your family, your friends, your loved ones, lean on them. Your support network should really be a safety net for you in your life. They are there to catch you. As nurses or anyone in the medical profession, we are bound by HIPAA law to not give out revealing patient information. So you always have to be mindful of that. But there is nothing wrong with saying, "I am having a hard time dealing with grief," and to talk about that. There have been times where I have come home to my family and I say, "I am having a really bad day. I dealt with some heavy things today." And just that comfort of having that safety net and allowing yourself to give that emotion to them, to share that emotion with them, to cry, to be vulnerable, that in itself can be a very healing thing. Another tactic that I have found helpful for me is journaling. Journaling lets me release my thoughts, my emotion, my grief, and handle it in a more private way. And as an introverted person, that is definitely something that helps me. I may not always be comfortable sharing my pain, my grief with others, but if I can write my emotions out in a journal and just release them, it definitely lifts a weight off of my chest. If you have a religious or spiritual practice, such as prayer, such as meditation, or anything like that, lean into it heavily. It will give you comfort and it will help you handle everything that you're going through when it comes to grief. Prayer for me is definitely a practice that I lean into daily. It helps give me inner peace. It helps me release my emotions and just find some peace in my heart to keep moving forward. And if you have a church or a religious community, really working on strengthening those bonds can be such a beautiful support for you. Don't cut yourself off from that. Even simple acts like asking your church or religious community or asking your family to pray for you, that can be so rewarding, so healing, and really very comforting. Another tactic that really works for me, and I try to include in my daily life anyway, but another tactic that really helps me deal with grief is the act of gratitude. I choose to be intentional about remembering good and beautiful things about the people that I've lost. I will sit down and intentionally call to mind funny things, sweet moments, sweet words that were passed between the two of us. And once I call those moments to mind, it's not long before I'm cracking a smile or I'm laughing. And I feel that that is such a beautiful way to honor someone's life and to remember them by. Remembering the good, the beautiful things, the beautiful moments about a person is really a great way to honor their lives and what they meant to you. So celebrate their lives, remember the good things, thank them, list them, meditate on them, because no one can take those beautiful things away from you, those beautiful memories. And that in itself is a gift. And it really helps when you are handling grief. Being outside in nature is something that also really helps me when I am trying to deal. Something as simple as walking outside for a few minutes, taking a short hike, a short walk, even just standing in the grass barefoot is very grounding, and it helps us to just remember that we are part of a greater story. If I am having a particularly nasty day, I literally sometimes force myself to get out of the house, to get some fresh air. And yes, it may not change the outcome of what has happened to me, but it does help to clear my head a little bit and to get my emotions in check. Sometimes separating yourself and just going outside, it allows you to get everything out. We have a tendency, or at least I know I do, to not want to dump onto the people that we love, to not want to let our emotions just bleed out all over the place. Me personally, as an introvert, I tend to hold things in, to pin things in, and I know that that's not a healthy practice. But if I go outside and I'm isolated, I can cry, laugh, scream if I want to, and hopefully no one's close by to hear me going crazy. But just to have that emotional outlet, to be outside in nature, it does help. And when it comes to handling grief, you have to remember to take care of yourself. Try your best to eat nutritious foods, to make sure that you're staying hydrated. Try your best to get in a little bit of exercise and do what you can to make sure you're taking care of your sleep needs. And I know that that is easier said than done, but you have to remember that you cannot pour from an empty cup. You really cannot pour from an empty cup. You cannot handle your grief, your emotions, your heartbreak. You cannot handle anything. And you sure as hell, excuse my language, you sure as hell can't help other people, the people around you, if you are pouring from an empty vessel. Try your best to fill yourself up. That is integral to the healing process. And I think that that is doubly true for nurses, for CNAs. You cannot go in and do your best job and put your patient's needs first if you are mentally checked out, if you are emotionally drained. Fill your cup, pour to yourself first, and let it overflow to others. If you have a fur baby, studies have shown that just love and time with your pet, with your little fur baby, can help to increase your mood. And there's mine knocking down the camera. And to help you handle grief a little bit better. I can tell you personally from experience that when I'm having a rough day, a rough time, just spending a few minutes loving on my animals, just, Hank, stop knocking down the camera. Spending just a few minutes of loving on my animals, taking the dogs for a walk, just getting all the love, all the affection, it really does make a difference. And I really feel like our pets know. Our pets know when we are going through something deep. And you may find that they are just a little bit more attached to you while you're feeling that way. I say all the time that we do not deserve animals. They are too good for us little humans. And they can really add so much just joy into your life. Hey, buddy. You're so cute. And last but not least, if you are experiencing a period of grief in your life and it is overwhelming and you feel like you cannot get out from under it, please seek help. Seek help. Reach out to others. Do it for yourself. Do it for the people that love you, whether that be your doctor, your pastor, a therapist, a counselor. There are resources hopefully available to you, even if that means just reaching out for help to someone that loves you. Have them check in on you more often. Having that extra support and that extra safety net can really go a long way. It is okay to ask for help. I feel like I've rambled just on and on in this video, and I hope that you guys were at least able to glean a little bit of helpful information. I really look at YouTube as like my happy place, right? I started this channel just as a hobby, something that I could enjoy doing that would add a little bit of joy into my life. And I try not to let it veer too heavily into subjects that can be painful. But this video has been weighing on me for a while now. Literally, for the last month, I have been waging war with myself, saying, should I make a video about dealing with grief? But at the end of the day, I know that grief is something we all experience. I experience it. Everyone in your life is going to experience grief in some form or fashion. That is the nature of life, it's the nature of the circle of life. And I feel like it does help to talk about it, to offer tips, to offer advice, especially when it's something that you deal with on a consistent basis. So it is my prayer that someone found this video helpful. It is my prayer that somebody found this relatable. And if you did, please like, please subscribe. I am a very, very small channel, okay? Teeny tiny, but I do want to grow. Until next time, you can find me somewhere in Tennessee.